From the outset, can I say the primary responsibility of myself as Premier and my government is to look after the well-being of the people of Morwell, and particularly the people in Morwell South. And to put this in context, you've just received a detailed briefing from the key agencies involved in this situation. And Craig Lapsley, our Fire Services Commissioner, would have advised you that good progress is being made in this very, very challenging coal mine fire. The government fully supports the work of Craig Lapsley and our career and volunteer firefighters. We welcome the ongoing support and assistance of firefighters from interstate, and we also welcome the advice and assistance from experts in mining and coal mines locally and across Australia. The situation with respect to the well-being of people of Morwell South is such that we take advice from our leading health experts, from Dr. Rosemary Lester, the Chief Health Officer. Dr. Lester is a distinguished medical practitioner who has served the community of Victoria and governments of both persuasions for many, many years. Dr. Lester is an eminent expert in these matters. She also receives professional expert advice from other health experts within the department and across the broader community. Today, Dr. Lester has advised the government that she is recommending that people who live in Morwell South or work in Morwell South who are aged over 65 years of age, who are preschool-aged children, who are pregnant women or have pre-existing heart or lung conditions, that those people, as a clear precautionary approach to their well-being, should relocate out of that area. Dr. Lester says this is an extension of her previous advice to government and to the community that people in those situations should seek relief by moving in and out of smoke-affected areas. Both the Chief Medical Officer and the EPA advise that the conditions and the environment is uncomfortable, but certainly not unsafe. But her clear advice to people in those categories is that they should relocate as a precautionary measure based on the longer exposure to that smoke and the potential for future exposure over several days as we take time to deal with this very challenging fire in the adjoining coal mine. As Premier of the state, I urge people to follow the advice of the Chief Medical Officer. This is sound medical advice which people should follow. However, there is no compulsion for people to relocate. It is a decision for those people. How I would urge that people follow the medical advice from Dr. Rosemary Lester. The government strongly supports the advice of Dr. Lester as our Chief Medical Officer, and that's why the government is put in place support networks for people to act on that advice. So we will be arranging for residents in that area to be contacted and contacted again, to be messaged, to be communicated with, so that people in the Morwell South area are contacted and given that advice, so people in those categories of young children, persons over the age of 65, persons who are pregnant, persons who have pre-existing heart and lung conditions are given that personal advice about to relocate. We urge people in the Morwell South area, indeed all people in the Morwell South area, and particularly those in that group, to contact the 1800 number, which is available on the DHS website, which is widely circulated. And for those who want it, it is 1800 006 468. And when they contact that number, they will be given appointment times and opportunities to meet one-to-one with DHS officers. We have expanded the number of DHS officers who are in the region. There are 3 sites and centres where people can go for those appointments, and people and families will be given one-to-one advice and assistance. We will be providing financial assistance for those eligible families so that that can assist them in their choice with respect to relocation in terms of their own wellbeing. I can also advise that following my visit here recently, we have boosted and virtually doubled the size of the Community Health Assessment Centre, where people can go and get health assessments on a walk-in basis, and there is certainly transport available for those who wish transport. We also urge people in the broader community to take advantage of the respite options. And over this weekend, certainly the Department of Human Services, together with the local council, have opened up more opportunities for people to have a break away from Morwell, a break away from the smoke. And whether that be attending events in the area, whether that be just leaving the area for a period, we urge people to take advantage of that situation. So, ladies and gentlemen, we as a government put the well-being of people in Morwell, and particularly in Morwell South, at the top of our agenda. We are certainly working hard with Craig Lapsley and the firefighters on the front line to put this fire out and put it out as quickly as possible. There is no lack of commitment from this government to provide the resources to Craig Lapsley in terms of the firefighting effort, and there is no lack of commitment from this government to provide the resources to back up the advice from the Chief Health Officer with regard to looking after the well-being of people in Morwell South.